Right now, inside the Oval Office, an executive order is being signed that is about to fundamentally alter the way every single child in America receives their immunizations. It is being officially called the Gold Standard Childhood Vaccine Recommendations. But according to pediatricians, public health experts, and doctors across the country who are reviewing the details, the practical reality of this order could completely upend the entire pediatric healthcare system. We are looking at a sweeping, unprecedented directive that intentionally bypasses traditional medical advisory boards to mandate a completely new approach to childhood vaccinations. And the immediate consequences are far more complicated and potentially far more dangerous than a simple stroke of a presidential pen. The stakes here involve the baseline health of millions of children and the logistical survival of the clinics that treat them. The core of this executive action, based on a detailed draft that was recently obtained by the Washington Post, focuses on one absolute, non negotiable mandate. It directs federal agencies to take steps to ensure that all childhood immunizations are administered at separate medical visits. The text reportedly states outright that the current practice is not feasible, completely reversing decades of standard medical protocol. Think about what that actually means for a moment. Under the current established schedule, infants and toddlers often receive multiple protections during a single routine checkup. This is done precisely to minimize the number of times parents have to bring their young children into a clinical setting while ensuring the child gets protected as quickly as possible during their most vulnerable early months of life. If you want to understand the facts behind the policies that directly impact our families and our daily lives, subscribe to this channel for independent, evidence driven investigations. This new executive order demands that these bundled shots be broken apart. Every single immunization would require its own distinct separate appointment. Specifically, the administration is heavily targeting the MMR vaccine, which protects against measles, mumps, and rubella. For years, the combined MMR vaccine has been the primary flashpoint for vaccine skeptics. There is a vocal and highly persistent belief among these groups that giving these three protections together in a single dose overwhelms a young child's developing immune system, or that it causes other severe long-term health problems. This belief has fueled countless debates and alternative health campaigns centered around medical freedom and parental rights. Extensive medical studies, peer-reviewed research, and decades of global public health data have repeatedly shown that the combined MMR vaccine is incredibly safe and highly effective. There is no mainstream medical consensus supporting the idea that the bundled shot is harmful. In fact, combining the antigens has been the cornerstone of eradicating these diseases in many parts of the world. But this executive order suggests that the White House is now directly aligning federal health policy with the specific concerns of those skeptics, essentially prioritizing their demands over the established data-driven consensus of the broader medical community. By targeting the MMR vaccine specifically, the administration is signaling that it is willing to dismantle proven public health strategies to satisfy a deeply entrenched cultural skepticism. This is exactly where the story shifts from a theoretical political debate into a massive, real world logistical crisis. We have to look at the immediate human consequence of requiring separate medical visits for every single immunization. The average child receives dozens of individual doses of various vaccines in their first few years of life to protect against polio, whooping cough, tetanus, hepatitis, and more. Breaking all of those up means dozens of separate trips to the pediatrician. For a working parent, this is not just a minor inconvenience. It is a staggering, potentially impossible economic and logistical burden. It creates a system where only the most privileged, flexible families can afford to fully vaccinate their children on schedule. Consider the daily economics of this mandate. It means taking time off work again and again, often losing hourly wages or burning through limited sick leave. It means arranging transportation, finding temporary childcare for older siblings, pulling kids out of school, and paying additional insurance copays for every single individual visit. For rural families who might live an hour or more away from their nearest pediatric clinic, the burden multiplies exponentially. The friction introduced into the system by this single executive order is astronomical. When you make a vital healthcare service significantly harder to access by wrapping it in layers of mandatory appointments, the inevitable, predictable result is that fewer people will access it. The policy creates an insurmountable barrier disguised as a safety measure. Doctors are raising immediate, urgent warnings about what happens when you introduce that much friction into pediatric care. They are deeply concerned that if you separate these vaccines too much, you artificially inflate the number of required medical visits to a point where compliance simply collapses. Parents are going to miss appointments. It is not a matter of if, but when. It is an inevitable statistical reality of human behavior and economic pressure. When you demand 20 or 30 separate visits instead of 5 or 6 bundled visits, appointments will inevitably be delayed, rescheduled, or forgotten entirely. Life gets in the way, cars break down, bosses deny time off requests, and kids get seasonal colds that force preventative appointments to be pushed back. And when those visits are missed, children will go without vital protections for much longer periods of time. They will remain susceptible to highly contagious and very serious viruses like measles, which requires an incredibly high community vaccination rate, usually around 95%, to prevent rapid outbreaks. We are looking at a federal policy that, in its explicit attempt to address the safety concerns of skeptics, may actively put millions of children at a significantly higher risk of contracting preventable, life threatening diseases. This is the exact opposite of what a public health policy is supposed to achieve. It is replacing a theoretical, unproven risk with a very real, mathematically certain vulnerability. This is not happening in a vacuum, and we have to look at the broader picture of what is occurring in Washington today. The timing of this executive order is deeply revealing about the pace and the strategic priorities of this administration. At the exact same time this highly controversial vaccine order is moving forward, Todd Blanche has just been officially confirmed as the Attorney General. We are watching a White House rapidly consolidating its legal and administrative power, pushing through major personnel confirmations and sweeping executive orders on the exact same afternoon. This is a coordinated display of executive authority designed to fundamentally reshape the federal government's relationship with public health. This is a crucial detail that matters immensely for the future of this policy. The rapid confirmation of a new Attorney General guarantees that the administration has its top legal defender firmly in place, just as it rolls out directives that are guaranteed to face immediate resistance. If the gold standard vaccine order faces legal challenges from medical boards, state health departments, or pediatric organizations, which seems highly likely given the massive disruption it will cause to medical practices, the Justice Department under Todd Blanche will be the entity tasked with defending this executive order in federal court. Moving these two pieces on the chessboard simultaneously shows a deliberate effort to enact sweeping changes and immediately insulate them legally against the inevitable backlash from the medical establishment. But let us look much closer at the actual mechanics of the draft order obtained by the Washington Post. The draft reports that the White House would divide childhood vaccines into 3 distinct categories. Furthermore, the order directs federal agencies to take steps to advance these categories to the maximum extent. What exactly are these 3 categories? The source material does not specify, which leaves a massive, glaring, unanswered question at the very center of this new policy framework. How these categories are defined will dictate the future of pediatric care in this country, yet the public is entirely in the dark about what metrics are being used to create them. Are these categories based on the severity of the disease the vaccine prevents? Are they based on the age of the child receiving them? Or are they based on political calculations about which vaccines are currently the most controversial among the administration's supporters? Categorizing vaccines at the executive level implies that the federal government is going to prioritize certain immunizations while potentially deprioritizing, discouraging, or entirely removing institutional support for others. These are not hypothetical questions, they are the immediate, real world consequences of dividing established medical care into arbitrary administrative tiers without transparent scientific justification. When you direct federal agencies to advance a completely new categorized schedule, you are effectively overriding the Centers for Disease Control and Prevention and the Advisory Committee on Immunization Practices. These are the scientific bodies that have historically relied on continuous medical data, outbreak tracking, and safety monitoring to adjust the childhood vaccine schedule. By codifying a totally new schedule through a sudden executive order, the administration is shifting the ultimate authority over pediatric public health from career scientists directly to political appointees in the executive branch. This represents a fundamental contradiction at the heart of today's events. An order officially titled the gold standard implies an elevation of care, a reliance on the absolute best available practices designed to protect children. Yet the available evidence and the immediate outcry from the medical community suggest it is doing the exact opposite. It is removing the logistical efficiency that makes the current standard of care possible in the first place. You cannot have a gold standard of pediatric care if the system is designed in a way that mathematically guarantees fewer children will actually receive that care. Elevating a skeptical theory above established preventative medicine creates a dangerous paradox where the government claims to be protecting children by actively making it harder for them to see a doctor. The administration's defense of this policy will almost certainly rest on the idea of parental choice, bodily autonomy, and individualized safety. By separating the shots, they will likely argue parents and doctors can carefully monitor their children for adverse reactions to each specific vaccine component, thereby increasing overall confidence in the vaccination system. They are trying to address a profound crisis of trust among a specific segment of the American population. But as investigators, we have to weigh that stated political intention against the documented real world consequences of under-vaccination. When a child misses a scheduled appointment for a newly separated measles shot because their parent could not get a Tuesday morning off from work, the window of vulnerability opens wide. Measles is one of the most infectious viruses known to humanity. It can linger suspended in the air of a room for up to 2 hours after an infected person has coughed and left the area. It only takes a very small dip in local community vaccination rates for a massive outbreak to take hold, as we have already seen in several isolated communities over the last decade when vaccination rates slipped even slightly below the herd immunity threshold. This brings us back to the central contradiction of the policy. If the genuine goal is to improve the health and safety of American children, how do you logically justify a mandate that medical professionals universally agree will lead to fewer children being protected? The White House is trying to engineer a medical compromise through executive fiat. They are taking the MMR vaccine, a single, highly effective, historically proven tool, and forcibly breaking it apart. But in doing so, they are ignoring the operational realities of how healthcare is actually delivered in clinics across this country. Pediatricians' offices are already stretched incredibly thin. They are dealing with chronic staffing shortages and massive administrative backlogs. Adding dozens of mandatory single shot visits to their daily schedules could easily overwhelm local clinics. It will make it significantly harder for sick children to be seen for urgent care, while healthy children take up endless appointment slots for individual vaccines that could have easily been administered all at once. The entire infrastructure of pediatric care is built on the efficiency of bundled appointments. We also have to strongly question what the phrase to the maximum extent actually means in the context of this executive draft. The order directs federal health agencies to take steps to advance this separated schedule. Does this mean the Department of Health and Human Services will begin withholding crucial federal funding from clinics that continue to bundle vaccines? If an executive order mandates that all childhood immunizations should be administered at separate medical visits, how exactly will that be enforced upon private medical practices and independent pediatricians? The draft suggests a massive, unprecedented expansion of federal government involvement directly into the doctor patient relationship. This is a profound irony, considering that many of the very same vaccine skeptics who pushed for this policy have historically advocated for strictly less government interference in private healthcare decisions. Now, the government is stepping into the exam room and telling the doctor exactly how they are allowed to administer standard preventative care. This is the precise tension we have to watch closely as the final text of the order is officially released. We know the clear intent is to separate every single shot. We know the MMR vaccine is the primary target, and we know that doctors are absolutely terrified of the logistical fallout and the looming threat of viral outbreaks. The evidence clearly establishes that the national pediatric schedule is going to change dramatically and that doctors anticipate a dangerous drop in overall vaccination rates. What remains dangerously unknown is the true long-term human cost of this sudden disruption. The administration has made its choice, betting that upending the childhood vaccine schedule is the right path forward. But the heavy burden of that decision will fall squarely on the shoulders of local pediatricians managing chaotic waiting rooms and on working parents trying to take another day off work just to ensure their child is protected. Subscribe to stay informed as we continue to track the real world impact of these decisions, hold institutions accountable, and separate the facts from the political rhetoric.